And it's my pleasure to welcome Dr. Stacie Levine from UChicago Medicine. She's going to be talking with us today about medications and tips for safely managing medications as we age. It seems like the older I get, the more medications I end up on. And so we know that this is a typical experience as we age, but there are things we can do to make sure that we are optimizing our medications and taking them safely. And that's what Dr. Levine is going to be talking to us about. I just want to mention that this topic, medications, is the third in our series of explorations of the elements of age-friendly healthcare, care that's safe and based on what research shows are the most important things to pay attention to as we get older. And these elements have been summarized as the 4 M's: what matters, medications, mentation, and mobility. We have already done a drop-in on what matters and how to communicate what matters to your healthcare team, and mobility. And so today we're on our 3rd M, which is medications, and we will be addressing mentation in future programs. Our speaker, Dr. Levine, is a professor of medicine and chief section of geriatrics and palliative medicine at the University of Chicago. She specializes in geriatric medicine and palliative care with a focus on pain management. And in her practice, she strives to provide the highest level of support to patients and their families during transitions in care. So welcome, Dr. Levine.
Thank you so much for inviting me. I really appreciate the time for all of you to be here with me today. And definitely, because we're a small group, I'm okay with you interrupting me with some questions, or you can put them in the chat, and I'll ask Barbara and Lucas to monitor the chat for me and let me know if there's anything that pops up, okay? Let's see. Moving along here. So just a brief disclaimer. So we're going to review general principles. Obviously, I'm not anyone's physician here in this group, so I won't be able to give you specific suggestions about your current healthcare and your medications per se. However, I'm happy to answer some general questions throughout. So just keep that in mind. So for this hour, we're going to talk about just in general some background about principles of medications. We're going to cover organization and safety. I want you to start thinking about right now, for those of you that are on medicines, how are you currently organizing them? How are you remembering to take them? And then communicating with your healthcare providers about your medications, and then some special medication tips. Okay, so if you are somebody who is not taking any medicines at all, I would say you are considerably in the minority of people in your age group. The vast majority of older adults consume at least one prescription medication for something, whether it's high blood pressure, diabetes, arthritis. I mean, it could be a number of different things. And a little bit more than a third of people are using 5 or more medications, which by definition is actually called polypharmacy. So we'll go into that in the next couple of slides. But just keep in mind that medication use is very common. It's not a bad thing. As we get older, we develop certain medical conditions and may require medications to help take care of them. So keep that in mind. So, but how do we define medications? And this is really important because I see a new patient in my office and I'll often ask them what they're taking, and they may believe it's just something that's a prescription. This is only things that require prescription are what I take. But the reality is we need to know about everything you're taking. So that includes just Tylenol. How often are you taking Tylenol? Or are you taking anything for pain that's over the counter? Are you taking anything for your bowels that are over the counter? Are you taking anything for asthma, allergies, anything for upset stomach? I mean, those are really important, critical things we need to understand and know. And even topical creams, things that you wipe on your arthritis, that we need to know. We also need to know about vitamins or any herbal medication, supplements, that sort of thing. We have to know about everything. So I mentioned polypharmacy, and this definition is different depending on who you ask, but most of us in geriatrics would say that 5 or more medications put you in the category of polypharmacy. The definition of polypharmacy is any collection of medications you take simultaneously to treat the same condition. So for example, people that have really high blood pressure that cannot be managed on one medication may end up taking several of those medications in different categories to try to control their blood pressure. I have a patient who's on 4 or 5 blood pressure medicines, and that's kind of the extreme, but that certainly is something that I've seen in my practice. And the thing to keep in mind about polypharmacy is that the more we add medicines to your regimen, the more likely you may have some risk of drug interactions, or what we call drug disease interactions. And what can happen, unfortunately, for some people, especially if they have a lot of different providers that they see, is they enter what's called the prescribing cascade. What that means is that, let's say you, I'll give an example. You start a new medication for diabetes, and it has a couple common side effects that include upset stomach, maybe some diarrhea, nausea. And you go see your doctor, and the doctor says, oh, well, you have an upset stomach. Why don't you take something for gas? And here's something to help control the nausea. And here's something to control your loose stools. And then they start adding more medicines, and then you start having a reaction to those medicines. Suddenly you go from having loose stools to having constipation, and they add another medicine to control the constipation, and you get a headache from the nausea medicine that causes. So, I mean, you kind of get it. This prescribing cascade, it's very common actually, and it can happen very quickly. And I've seen it land people in the hospital from having side effects from these. So how can you learn from this? Well, certainly whenever a doctor or prescriber is giving you a new medicine for a symptom, think about whether that symptom could have been triggered from an old medication that you were on. It's a very good conversation to have and to be aware of. And we do know that people that have polypharmacy are at risk of falling from being on multiple medications. They may lower their blood pressure, they may get dizzy, something like that. And so there's definitely clear-cut guidance on this, that we have to be very mindful of polypharmacy. I would say that, you know, if a patient comes in as a new patient, they bring a big bag of medicines from their home. And I say, bring in everything. I don't care if you're not using it anymore, bring in everything that you're on. And I will literally count how many different drugs they're taking. And I've seen people on 23, 25 different pills a day. So, I mean, that's more of an extreme, but it can definitely happen. Okay. So we also know that as we age, our ability to metabolize medicines will change. Okay, that is across the board. So as we get older, our kidney function changes. We don't manufacture, we don't help with the water, like prevent dehydration as well as when we were younger. We are unable to absorb medicine as clearly as we were when we were younger. People may have chronic gastritis that prevents people from dissolving the medicines, or our lean body mass changes. We end up having more adipose tissue, and that can change where the drugs lie within our system. So all of that is to say that as we get older, we may be more susceptible to side effects or not metabolizing drugs as efficiently as when we were younger. And sometimes I do have to back off on med doses. Someone who was on the same blood pressure medicine for 20 years, they turn 90, I start backing off on the dose because it's a little too strong for them now. Certain medicines are also unsafe, considerably unsafe in older folks. There's something that we follow called the Beers criteria. It's spelled like beer, B-E-E-R, and it's a well-documented, published guideline for clinicians that is updated over a period of several years. And they put what I call no-no medicines on that list, or medicines that we have to be very judicious with using because of the concern of how it would impact an older adult. So one of the drugs that's always on there is Benadryl, because it's a common over-the-counter medicine. People think it's benign because it's sold over the counter, and it can cause a lot of side effects, actually. Number one, people may take it to help them sleep, and may actually cause the opposite paradoxical reaction where they actually get more agitated at night and they can't sleep at night. I've seen that happen. I've also seen people men develop urinary retention from Benadryl, because it can impact the way the urine comes out through the prostate. I have seen somebody pass out from taking Benadryl. So we tell our patients, please do not take any products with Benadryl in them, because they can have more problems than you really need. And then also the time to benefit of medications is another important principle that we follow. There's certain medicines that as we get older may not be as useful. Somebody who's well into their 90s and their cholesterol pill may not be that useful anymore because they may not live long enough for it to benefit them. So these are all really good things to keep in mind when you have conversations with your doctors. All right, let's move into organization and safety. Okay, I love when my patients come in with something similar to this. They know the name of their drug, they know what it's for, when they started it, who their doctor is that prescribed it, even the color or shape of the pill. It's funny, like patients will come in and be like, that little white pill that I'm taking? And I was like, no, I don't know the little white pill that you're taking, because there's so many little white pills. So, and I've seen family members do this. If they have a parent that they're a little concerned is possibly going to confuse medicines, they'll actually take one of the pills and tape it to a card that's like this, so that they can see the color and the shape, in case somebody loses the medicine and they forgot what it was. The dose is important. And of course, any clear-cut instructions, like what time of day you're supposed to take it, how many times a day. I mean, these are really good things to keep in hand so that you will keep track of what you're taking, and that and to give to your family members too. I mean, you know, it's helpful for when I speak to my parents that I know what they're taking, so that if their doctor ever called me, I could very easily say, oh yeah, this is what my dad's been on for his diabetes. Okay, so keeping track is a really good thing to do. Also, keeping in mind when the expiration dates are on your bottles. So you may have some old pain pills in your medicine cabinet, or some old medicine for something else. And, you know, those do expire, maybe not until a little bit after the actual expiration date, but still, like, you know, probably don't want to hang on to something that's really old. I have medicines in my medicine cabinet that are probably 4 years old that I haven't gotten rid of yet that I need to. So just keep that in mind. And always, as you guys know this, but keep medicines out of the reach of children or pets. I will tell you that I'm seeing an increased utilization of those THC gummies of all ages. So I had clinic a few days ago, and 3 of my patients I saw in clinic told me that they were using THC gummies for various reasons, for pain, for anxiety, for sleep. And that's not something that doctors regulate. We don't prescribe that, but there's definitely an uptick in people using it. And so it's important for me to counsel on the utilization of THC gummies. And also, they look like candy. So children, grandchildren, pets can get into those things. And obviously you don't want them to do that. So keep everything out of the reach of children and pets. So I don't know how many of you use Pillboxes, or if you need to use Pillboxes. I think they can be very handy. You know, if you're someone like me who sometimes forgets if I've taken something, or, you know, whatever, it's just good to fill it up on a Sunday for the whole entire week, or you even have monthly planners. And that way you don't have to second guess yourself whether you took something or not. There's also these blister packs. You can see this here that some pharmacies are using now that are easy to just dispense one time, you know, and this is morning, noon, evening, and bedtime doses of medicine. So that's another way to keep track of your medicines and keep organized. Okay, basic principles about medication safety in general. Number 1, turn on the light. You know, don't take your medicine in the dark. You may accidentally take the wrong thing. I had a friend of mine who is on a blood pressure pill, and she was taking something for sleep, and she mixed them up in the morning, and she took her sleeping pill in the morning, and then was like, why do I feel so tired? She thought it was her blood pressure pill. And so then she went back and she realized that she took the wrong medicine because she was taking it in the dark. So I'm like, please don't do that. Obviously, you need to follow the instructions, right? The way the doctor prescribes it is the way you should be taking it. And let us know if you drink alcohol, or you smoke cigarettes, or use any sort of drugs, like I said, the THC gummies, because that can impact, you know, what I prescribe, or what time of day I ask people to take medications. Make sure you take them on the time that was told you. So some medicines have to be taken in the morning on an empty stomach, like thyroid pills, or the medicines that we call bisphosphonates, which are for osteoporosis, because the absorption is impaired if you take food with it. So we often say, get up in the morning, take it on an empty stomach with a full glass of water. Don't stop medicine without telling your doctor. I do have, you know, patients who have been like, you know, that medicine you prescribed for me, Dr. Levine, it didn't really react well with me, and I just stopped taking it. And I was like, oh my gosh, why didn't you tell me you stopped taking it? I wish I would have known. And of course, don't share your medicine. Don't share with your sister, here's a pain pill, you're having some pain. Don't share your blood pressure medicine with your friend. I mean, this is medicine that you shouldn't be doing that, because if they have a side effect or a bad reaction to it, then it's not a great thing to happen. So please don't do that. All right, let's move into communication about medications. All right, so yes, very, very good. For every office visit, just bring in your medicines if you can, or if you can't, bring a list like the card that I showed you, because that way we can kind of take a look and see if anything's expiring. We can see how you're doing with the number of pills. We can see if there's any potential drug interactions. I mean, there's lots of things I can do when I review people's medications. I like to do what's called medication reconciliation. That's where I literally line up the bottles in front of me on my desk, and I try to envision are these medicines the right medicines? Do any of them interact with each other? Is there a new medicine here because you just got out of the hospital and I need to make sure that you're not taking that one and something that was supposed to be stopped? There's lots of reasons for you to bring in your medicine. So bring them in a brown bag so we can go through them together. And, be an advocate for yourself. Not every doctor has the time or the wherewithal to go over like medication pricing, for example. That's a very common thing. I was shocked when my parents told me they were spending $3,500 a year on drugs. I should have known better, right? I should have had that conversation with them. I'm a geriatrician, but I just didn't know. And then when we looked into it, they were prescribed a lot of name brand medicines that they really didn't need to be on. And it was, I was encouraging them to go back and speak to their doctor about finding a cheaper alternative because there were alternatives there in their insurance plan that they just were not aware of. So be very proactive, ask all sorts of questions, confirming if the medicines are still necessary. I had a patient I saw this week in clinic who was prescribed a medicine for his prostate, and he was still having a lot of urinary symptoms. And, his wife was like, is this still necessary? And I said, and she was saying it was costing her $100 a month. I said, oh, if it's not working for you, then speak to the urologist about whether or not he should be on it. So confirming if it's still necessary and then bringing up costs as an issue. Lots of doctors do not know how much medicines cost our patients. And we feel really badly when you're spending a lot of money on your medicine. And, at University of Chicago at our DCAM pharmacy, we have a $5 drug plan. I have a luxury of having a geriatric pharmacist in my clinic with me, which is like a godsend. And that's very uncommon, but I am able to go up to him and say, Mrs. So-and-so's insulin's costing her this much money. Is there something else we can give her, a different version of it that's just the same? And he'll let me know. Or is there another blood thinner she could be on that's cheaper? So we try to work together, but that's a luxury. We don't have geriatric pharmacists in every primary care clinic. So talking with your doctor before starting a new medication, if you're getting out of the hospital and somebody's saying you need to be on these new medicines, I would say, don't wait. I mean, you shouldn't wait if you're on a very essential medicine to like your follow-up appointment in 2 weeks. And I've had patients do that where they're like, I'm not taking this medicine until Dr. Levine says it's okay. And then they don't take it for 2 weeks. And I'm like, okay. But make sure you review your allergies on a regular basis. If you've had any reactions to medicines before, we don't always remember that you were on a blood pressure pill 2 years ago that you had a reaction to. Might not be that you had we keep allergies in mind, but some people have side effects that aren't really allergies and they don't tolerate the medicine and we stop it. But if this was like 2 years, 5 years ago, I may not remember that. And if I need to change your blood pressure medicine, it's good to know that this old one never worked for you. So we don't always remember those things. So it's good for you to keep a diary or a log of medicines that just were not good for you. So you can remind us. And yes, and finding out if you need to change or stop other medications. A good one is aspirin. So there was some new data that came out recently in the last couple of years showing that taking aspirin for what we call primary prevention, which is like you've never had a stroke before, you've never had a heart attack before, you actually don't have really any other good risk factors to have a stroke or heart attack. Taking a baby aspirin every day actually is not necessary. And so again, I'm not your doctors. I would say if you are on a baby aspirin, you're not sure if you should still stay on it, I would say talk to your doctor about this. But I do end up, reevaluating based on medical evidence that comes up whether or not this medicine should be still something my patient should be taking, or if I should give them an alternative. Okay. So when starting new medicine, here's some good sentences or language you can use. Okay. And just asking yourself or asking your doctor or the nurse practitioner, well, number one, what's the name? What is it called? Is there a generic name and trade name? What is it treating for you? How many times a day should I take it? So for example, if the bottle says you should take this medicine 4 times a day, does that mean 4 times during the day when you are awake? Or does it literally mean every 6 hours because that's 4 times in a 24-hour period of time? Like, what does it mean when it says 4 times a day? Also, how much medicine should I take? Is it 1 pill, 2 pills? I definitely have had patients who were told to increase their blood pressure pill by doubling up on the dose, going from 1 to 2 pills a day, that they left the office and they forgot those instructions. So even in the best times when we have good conversations, people can forget. That's why I say write everything down so that when you go home, you remember what your doctor told you. And then what about taking it with food? Should I take it on an empty stomach? Does it matter? Is there anything that I should not eat or drink while taking this medicine? You know, the pharmacists are usually pretty good with that. And it may say that actually on your instructions when you pick up a medicine, but it's never a bad thing to ask your provider as well. And then how long should I expect to take this for this medicine to work? So like things like antidepressants, they can take 3 weeks at least to start kicking in. And I always tell my patients, don't give up on it. You have to wait a good solid three weeks at least for it to start working for you. Will this cause problems if I'm taking other medicines? This is getting into drug interactions. How about, is it safe for me to drive while taking this medication? Very common. You know, if someone's taking a pain pill, you know, should I be operating any heavy machinery or be behind the wheel? And what does it mean to say something's as needed? As needed for what? As needed for pain, as needed for loose stools, as needed for constipation? Like, what does that really mean, as needed? And when should I stop taking the medicine? So this is also another common mistake that I've seen happen, where somebody's prescribed a new medicine in the hospital. Let's say they add a blood pressure pill and they only give them a 30-day supply because they're not going to be refilling it for them. It's going to have to be on the primary care provider. Patient comes and sees me in clinic, that let's say they missed their follow-up appointment. They come back and see me 2 months later. And I come to find out that they never refilled that new medicine because it only said 30 days. And they're like, oh, I just assumed that I have to stop it after 30 days. And so that's happened to me before. So make sure you understand, is this a medicine that I should keep taking or do I stop it at some point? And if I forget to take my medicine, what should I do? Do I double up the dose the next time? Do I just wait it out till the time I'm supposed to take it? I mean, those are good things to have in mind, you know, certainly, especially with like blood pressure pills, because I've had people double up on their blood pressure pill in the same day and then get really woozy. And like, you know, if something happens, just call your on-call doctor or during the day, call the nurse and see if they can give you some advice. Side effects. So, you know, keep in mind that every single medicine that's prescribed out there has a long laundry list of potential side effects that can happen. And that's by law, the FDA requires us to have those on the prescriptions. It doesn't mean that it's going to happen to you. And it could be exceedingly rare. It could be less than 1% of people have this particular reaction. But this is a really common reason why I have patients come back and tell me, you know, Dr. Levine, I read the instructions on this and I'm not taking this medicine because I just got scared to death when I read all these potential side effects. It really frightened me. So I try very hard to counsel when I'm starting a new medicine about what to expect. I really try hard to do that. But sometimes they get this list of like, it's going to cause dizziness. It's going to do this. It's going to do that. And they're like, oh, I just can't do that. So make sure that you understand, you know, really the reality of these problems of what you should expect or what's the most common thing to expect with these things. And then how do you get your refills? Okay. So if you are someone who's in the hospital, make sure when you come in that you bring in all your medicines, even herbal supplements and things like that. A common thing that can happen, let's say somebody's getting chemotherapy, some of these herbal supplements people take can actually react with the chemotherapy and prevent it from working very well. So your doctors are going to want to know everything that you're taking, whether it's inpatient or outpatient. And do not take your own medicines when you come into the hospital. I've seen people bring in their bottles of tramadol for pain and get caught by the nurse taking their own pain pills. And that's not something that we really can be doing. So please don't do that. And as I had mentioned before, when you're prescribed a new medicine in the hospital, make sure you're aware of these med changes, write them down. What should you stop? What should you continue when you leave the hospital? So you have a very clear discharge plan. That's where things go wrong. For me, most of the time is their care transition issue. Coming out of the hospital and getting confused, going to a rehab facility, then someone else changes their medicines. And by the time they get back to me, there's been all these different medicines prescribed and taken away, and we have to really sort those out. Okay, moving into special medication tips. So let's see, when you're traveling, there's a few important things, and I'm hoping some of you that love to travel are getting back to traveling again, because I feel like we've all been kind of hiding the last couple of years. So knowing how to change your routine, if you're traveling across time zones, knowing what the right time of day will be for you with your medicines, bring all the phone numbers of your doctors and your pharmacy with you in a car, on a card, or have it with you. Have a list of your medications. Carry your medicines in your carry-on, or at least some of them, because God knows if your luggage gets lost and you're without your medicine, how tragic that can be. Always keep your medicines out of the heat and direct sunlight too. That goes without saying. You want to keep things safe, stored well, properly, okay? All right, let's get into generics versus brand name, because this has come up for me as well, where a patient will say, I only can take brand name. I cannot take any generics of any sort. And then I'll say, okay, well, why is that? What happened? And they'll usually tell me some kind of a reaction they had, and they said it was probably from the generic. And it's really hard to know really what it truly happened. I mean, the reality is it's the same stuff, whether it's generic or brand. You look at the ingredients, it's the same stuff. There may be something different in terms of the inert substances that they use to create the pill. So it's possible somebody is having a reaction to an inert substance in the generics. I mean, I'm not saying you can't have a reaction to a generic versus the brand name, but I do, this is the conversation I had with my own parents when they were spending $3,500 a year on medicines. I was like, oh my gosh, how many of these are brand names? How many of these actually have generics? Can we go on the generics and save you a lot of money? And we actually did do that and had a lot of success in changing some of those. So, very good to review this with your doctors, of course, and seeing if there's another alternative you can use if your medicine is expensive or if it's a brand name. A little bit about pain medicine. So sometimes strong pain medicine are needed, okay? You have a hip replacement and you need to be on oxycodone for a few days, or you have, severe arthritis and you're not a candidate for joint replacement and you cannot function without a stronger pain pill. That is okay. I mean, I would never tell people you can't take something for pain. I want people to be functional as much as possible. And generally they're safe in short-term use. The longer you take pain medicine in general, your body will form some sort of physical dependence on it, which means that if you were to stop something cold turkey, you could have withdrawal reactions on a pain pill. So you want to be very mindful of that. And we tried to really just be very low in the dose and never take greater amounts than is absolutely necessary, because people can, as we get older, we don't tolerate these medicines as well. We get more constipated, we get more dizzy, and of course that can cause falls and other problems. So there's always something good to review. Here's another really common question I get. Dr. Levine, I have this bag of medicine, it's expired, or I'm not on these anymore. Can you get rid of it for me? And unfortunately, I can't dispose of my patients' medications myself because I don't have a disposal system within my clinic. Number one, you want to keep things locked up. Number one, especially pain medicine or any sort of mind-altering prescriptions. Know what you have, but there are ways to dispose of your medicine. So number one, police stations have some availability to do that. Your local pharmacy should be able to tell you how to do that. I know DCAM Pharmacy, we have a MedSafe box. See this, I think you can see it right here, this picture here, where people can dispose of their medicine safely. So there's ways to get rid of your old medicine. What we tried people not to do, please don't flush it down the toilet, number one. That's what we shouldn't be doing that. And also we try to get people to tell me, oh, I just crush it and put it in coffee granules and throw it in the garbage. We try not to do that either. I really try to have people bring it to an actual safe place and dispose of it that way. So just, keep in mind ways you can dispose of your medicine in the proper manner, okay? Brief word about herbal products. So as I had mentioned in the very beginning, these are very important for us to know about. They're not regulated by the Food and Drug Administration. So I couldn't tell you if you came in with 17 bottles of herbal things that, this one promotes good memory, this one promotes helping arthritis, this one promotes good digestive system. I would not be able to say I approve of that herbal medicine because I have no idea what's literally in it. And, it's funny, I was watching some news show where they actually they bought up, I don't know, maybe it was like 15 different herbal medicines that were out there promoted on the market. And they looked to see what was actually in them. And like 85% of them had mostly grass, like ground up grass. It was not a real herbal product. So there's a lot of scams out there, I think, with these products. People want to make money off of you. They want to promote that you're going to live forever if you take these herbal products. Just be very mindful of this and if anything, do a Google search and just really try to be educated about these things. Because honestly, if you're an otherwise healthy person, you're physically active, you're eating a heart healthy diet, Mediterranean diet, there's really not a lot of reasons to be taking a bunch of herbal supplements unless it just makes you psychologically feel good about your health. I won't tell people not to take them unless I do think that they're going to cause a drug interaction with one of their current medications. Like I'd mentioned, the chemotherapy concern. So always good to tell your doctor when you're taking these things. Okay, so here's some common questions and answers. And I think then we'll have a few minutes for some questions from you all. So here's issue. You can't read or understand the direction on the labels. Extremely common. I'm starting to lose my eyesight. My short sightedness is happening. Farsightedness. But anyway, the bottom line is, buying a magnifying glass to be able to see if you can. Some of these pharmacies are able to increase the print on the bottles, but there's very common errors that can happen, especially if you have medicines that look similar in name, right? It's a blood pressure pill. There's hydrochlorothiazide and something else, or hydrocodone and hydrochlorothiazide, and people can mess them up pretty simply. So just make sure you have those in front of you. And another common issue is trouble opening your medications. I heard people mentioning their hand arthritis before I began this talk, and there are ways that there's easier to open pill bottle tops that exist. I'm not sure which pharmacy you all use, but certainly worth asking if you're having some trouble opening your bottles. Pharmacies are trying to get really better at this because they understand, how difficult it can be to open up these little tiny bottles. How about healthcare providers not providing enough information about the importance of taking your medicines properly? Well, we all know it's very important, especially for medicines that you're using to treat chronic conditions like high blood pressure or diabetes, and if you don't experience symptoms, if your blood pressure is not controlled, most of the time you're not going to know it. You're not going to feel it unless it goes way high and you get a headache. But you're not going to know if your cholesterol is out of whack. There's certain conditions that it's just not, or osteoporosis or something, you just can't really physically tell if you're not taking it correctly. So it's very important to just, again, have these conversations on a regular basis about what your medicine is for and how it is going to benefit you. Like, what are the results that they want to see to know that this medicine is working for you? And if it's not working for you, what are you going to do about it? If I start someone on a blood pressure pill and they come back and their blood pressure has not changed at all, then we need to talk about what else is going on here? Are you eating too much of a high salty diet? Do you need to exercise more? Do you need to lose a little bit of weight? Is there something else that doesn't involve me just increasing your blood pressure pill? How about worrying about possible side effects of certain medicines? So we kind of already covered this. This may cause dizziness. It's universally on almost every single pill that's prescribed out there, or may cause headache, very common. So talking to your doctor about how the reality of this actually happening, or what to do if you do experience this. So a blood pressure medicine, definitely, especially when you first start taking it, can lower your blood pressure. So how can you counteract that while your body adapts to this new blood pressure medicine? Getting up in bed, sitting with your legs over the side, pumping your arms before you stand up. Really trying to take it easy while you're adjusting to this. Okay. And then knowing what your blood pressure goal should be. Okay. Because that's different from person to person, depending on if you have any cardiovascular disease or your age. And so that's another important point to talk about with your doctor is, I'm going to start this blood pressure pill. What do you want to see as a good result when I come back? What would you be happy with? All right, so a couple key takeaways. Number one, know your medicines, know what they're for, be proactive, write it down, keep it on a card that I'd shown you. Very good. I countless patients who have no idea what they're taking their medicine for. My father-in-law, I just reviewed his medicine, and he had no idea why he was taking a couple of the medicines he was on, and he's a very highly educated man. But I think he just assumed that his doctor knew what he was doing, and he does. But I was like, it's really important for you to understand what you're taking and why you're taking this. Communicating regularly with your providers. We were mentioning in the beginning of the talk about how useful my chart is when people are using it. And then, of course, properly storing and disposing of your medicine. So, okay, I'm closing with this last slide. I want you all to think about how this went, this talk, and what is one thing you've learned that you're now going to change or incorporate into your life that you hadn't been doing? Or are you doing all of these things already and I'm just basically preaching to the choir? If any of you have the opportunity to share, would like to tell us what you're doing, I would love to hear about it if you're open to it, and how else can we help you. So I'm going to stop right there, and I can stop sharing my slides so we can see each other. Susan?
This is great. I thought I knew all of these things, and this is very informative, I think. Thank you so much.
Okay. Barbara?
I would say the thing that helps me the most is having setting up my medications for the week. And luckily everything is, I don't take anything more than twice a day. So I just need AM, PM. But setting it up at the beginning of the week is, for me, has been very helpful in terms of knowing that I've taken it each day. And so but I like the idea of the monthly pill minder also, because it's helpful when traveling and you're gone for more than a week. I had two questions. When a medication is recommended to be taken with food, how much food does one need, especially if it can't be timed with a regular meal?
Not much.
Not much.
A little bit of milk, just enough to
Okay.
coat the stomach. Because if it's usually when you take it with food, it's because it might upset your stomach.
Stomach, right?
So just enough to kind of coat it. Yeah. It doesn't have to
Okay.
be a large, huge meal.
Okay. And then my other question is, do you know where to, if you have a sharps container for like, sharps that you use at home, are those accepted at the pharmacies, or do you know where those get turned in?
Yeah, that's a great question. I don't know. I'm not sure. It's worth asking. I don't know. Like UFC they might have the decam might have some area,
Yeah.
but I don't know.
I've tried the commercial pharmacies, and I get my prescriptions through the mail. So commercial pharmacies didn't seem to have any clue. The pharmacists I talked to there didn't have any clue. So I just thought I'd pick your brain.
Question though.
I have a comment and then a question. Those packets that you mentioned to put medications in to dispose of,
Yeah,
we have those at our resource table when we have in-person drop-ins. They're just to the left of the check-in registration. They are black and they're kind of rectangular in shape.
Lovely.
So we have those there for you. And then secondly, not always, but every once in a while, I forget to take my blood pressure medication, and I'll remember later at bedtime. So I go ahead and take it. It's only once a day. I don't think I've had a problem, but should I be worried or just skip it or?
Yeah, I mean, usually if it's like a 12-hour thing, you've missed it and you take it 12 hours later and then you're going to take it in the morning, it's not such a big deal. I think it's the medicines that are like you're taking it 3 or 4 times a day, which is very rare these days. I think it's really difficult to remember to take medicines that are 3 or 4 times a day. It's just not fun. But yeah, I mean, I think if you just slipped your mind and you took it later on, you're going to be okay, at one time. What you don't want to happen, and this has happened, is I've had somebody take a pill and they're getting forgetful, and then they just take it right after, within 30 minutes. They took their second dose of their blood pressure pill, and then they get this big drop in blood pressure, and they get super dizzy, and they may fall and end up in the ER and that sort of thing. So that's why having a pill box can be very helpful, because even the person who feels like they have the sharpest brain, I mean, we get distracted and we forget, did I take that? I can't remember if I took that a half hour ago.
Any other questions for Dr. Levine?
Or any thoughts, anything, any helpful tips or tricks that you do to stay on top of things when you go see your providers?
And you're talking, but you're muted. And you're muted.
Oops, you're muted, Ann.
Sorry. Do you have any tips for medicines that you take once a week? How to remember?
Yeah.
That's the hardest.
Yeah. Once a month. Yeah. There's a bone pill that we give once a month. And it's just like, for that, I'm like, it's the first of the month, just first of the month. For the once a week too. Yeah. You have to pick the day of the week that you think you're going to remember. And,
That's,
that's why a pill box can help, because then you're going to put it in on that Sunday morning. That's when you're going to take it, Yeah, those are hard.
they are, yeah.
They're very hard. And it's good when you're honest with your doctors and say, I have to be honest, I can't remember to take this medicine all the time. I've been skipping a couple doses, because sometimes a thyroid medicine is a very common issue I have, where number one, you're supposed to take it on an empty stomach in the morning, to help with absorption. And then I have people, if let's say the doctor prescribes you take a full pill on one day and a half a pill the next day, then you go on a full pill, like this kind of all over the place thing. And then I check their thyroid blood test and it's not where it should be. And so before I even go into making any adjustments, I'm like, okay, wait a minute. Just tell me honestly, have you been skipping any doses or not taking the right dose? I mean, just be honest with me, because I don't want to start changing medicine doses unless I'm clearly convinced that they're taking it the way they're supposed to.
What do people need to bring, sometimes you read in the popular media that if you travel, you should take your pill bottles with you with the prescriptions, but that's a lot of extra stuff to take along. Is that really necessary? Do you have any idea?
I don't think so. I think what you don't want to do, and I'm guilty of this, like I have a bottle sitting in my medicine cabinet where I went on a trip, and I don't take much medicine at all. It's like over the counter, like, oh, here's some ibuprofen, here's some Tylenol, here's some iron pills or something. I don't even remember what, but you have this bottle and you put it all into one bottle, and then you think you're going to remember what they are. And then now to this day, I'm like, I have no idea what these things are, and you have to dispose of it. So just make sure that you clearly somehow label it so you remember what it is.
Yeah. Other questions or comments?
I'd just like to go back to my original comment. How do we get people to pay attention to this? Because as I say, I thought I was very familiar and very, knowledgeable about medicines and how I take them and keeping track. But there's so many tidbits and little things that I hadn't thought about in what you presented. And I don't know, I think we will have a recording of this so that people can go back and listen to it. And I just think we need to really promote it, educate it,
right,
on paying attention. Their medications are important.
Right. And as I said, don't assume that your doctor, who may have the biggest heart in the world, is thinking about all of these things. I mean, it's because there's a lot people have to go over in a doctor's visit, and they may not have the luxury of a 30-minute visit like we do to go over in detail the fine print. Like I said, my parents' doctor had no idea they were spending $3,500 a year on medications, and I'm sure they felt badly once they found out that was happening. So yeah, being proactive is really critical. It helps us understand where you're coming from too.
I would say this, we have a first Tuesday dinner salon at the Snail Tie, and I was making announcements about this upcoming drop-in, and one woman out of nowhere said, oh, we need to pay attention to this, because I don't know how far back in her history, but she had some interactions with medications, and she was in the hospital for a week and almost died. So, I mean, that was a serious testimony. And there's only 3 of us on this call, this Zoom today, that actually heard her say that. So the other 15 or 20 aren't here.
Is she here? I hope she's here.
No, she's not. But I mean, it really, it distilled us for a moment.
Yeah.
Well, I mean, adverse drug reactions are a very common reason people get admitted to hospitals. I mean, I think the number for people that have a drug reaction to being on ibuprofen, like, do you think ibuprofen is a very benign medicine you can buy over the counter, but it can cause gastrointestinal bleeding. It can cause kidney problems. And I think it was like 18% of adverse drug reactions that end up in the hospital are related to ibuprofen. And
Wow.
like the Benadryl, like I cannot overstate how unsafe Benadryl is. And, you know, I had a patient who ended up, they called what's called a stroke code on her. She was found down in her home and they airlifted her to a stroke center by helicopter. They thought she was having an acute stroke. And when they ended up working everything up and treating her and whatnot, it turned out that she took 2 Benadryl in the middle of the day.
Oh, wow.
And she was
Wow.
found on the ground. I don't know why I think she told me later, she doesn't even remember why she took those 2 Benadryl. She thought they were pain pills or something. I'm not sure why. She got them confused and she went through all this whole process, this hospital admission. She got treated with a blood thinner for what they thought was a stroke. And at the end of the day, it was a drug reaction. So yeah, I mean, I can't overstate stuff you can buy on the grocery store counters can be unsafe. And, you know, you just need to talk about that with your doctors and make sure it's okay to take it.
Yeah. And you have to watch what's in some of these medications like Tylenol PM and things like that might also have things in them that wreak havoc with your.
It
as
has
you get older.
Benadryl in it. It
Yeah.
has Benadryl in it. And
Yeah.
sleeping issues are, everyone universally has a sleeping problem. Not everyone, but vast majority of my patients have sleeping. They can fall asleep, but they can't stay asleep. They're tossing and turning. They maybe get 4 hours a night. And we talk a lot about sleep hygiene and helping people get through. And most people do okay because our sleeps are never going to be normal as we get older. That's just the fact of life. But some people feel that they have to get that straight out 8 hours and they end up taking sleeping pills at night. And those, you know, really are not meant to be long-term either because of all the problems that they can cause. So,
Yeah. Other questions? I think this has been a great presentation. I'm so glad we have a recording of it and it will
Yes.
be posted on our website. Are there any last questions, comments, information we'd like to glean from Dr. Levine? She certainly has. You are so practical too. I mean, you're the first person that I've heard say, health professional, it's okay if you don't, it's normal that basically that you're not sleeping more than 4 hours a night and it's going to happen as you age. I mean, that in a way it's reassuring to know that's not an unexpected change as we age. So I appreciate
yeah,
that, Dr.
I mean, it's
Levine.
annoying. It's annoying to be up
annoying.
at 3 a.m. and then to get out of bed and read a book and try to like will yourself back to sleep. It's very annoying. Unfortunately, though, that is part of normal aging. And you may have some friends who sleep well and we're jealous of them because we can't sleep through the night. But you know, it's I've had to reconcile that myself as I've become middle-aged too, is that I don't sleep as well as I used to when I was younger. But I feel fine when I'm functioning the next day. That's the question you need to ask yourself about sleep is, am I functioning the next day? And if the answer is yes, then you're just going to have broken sleep and that's what your body's doing. So.
Well, thank you very much for an interesting presentation and
Yes.
for taking our questions. And again, we'll probably at some point in the future repeat this because this is something that people share over and over again. But thank you. And we will keep the chat open for any of us that want to remain on and talk about things. But thank you so much, Dr. Levine. We really appreciate your time today.
Okay.
Thank you.
I'm going to sign
Thank
off.
you.
Thank you.
Great.
Take care.